Nucci from Nucci Medical, and this is our Coffee Talk, our Friday Coffee Talk now with coffee. You're ready to go right there. Actually, I had some already. Thank you for joining me this afternoon, Friday afternoon. Today's talk is going to be on low back supports and do they help back pain? Do they make it worse? Why would you use them? This kind of thing. And I'm often asked that. I actually give the patients some low back supports along the way, but they are, controversial whether they help or not. And I'll give you my take on back supports. We're talking predominantly about the softer back supports, the ones that you might see people wear at Home Depot, and some have straps and so on. Not the rigid clamshell, we call them back supports. That's really a different kind of thing that you would use for surgery, although people are moving away from that also for reasons which we can maybe discuss at the end. But some of the soft ones, and do they help prevent something, or do they help low back pain? And the answer is it may. It's somewhat idiosyncratic. The concept is that you're using your abdominal muscles too in order to move. And if your back muscles are weak, you can use your abdominal muscles additionally to give you support to keep you stable. So it goes around it does go around your whole midsection. The times that I have found it effective, really in two different instances. As far as the prevention of low back pain, there may be some feedback that you have a back injury of some sort, and that will remind you not to maybe lift too much or twist the wrong way. So it's sort of this sensory reminder that you have something going on, or that you need to protect your back and lift correctly and so on. So it's like a string on your finger kind of a thing. It reminds you to act appropriately with your back and treat your back the right way, and don't lift the wrong way and so on. So there's some advantage there. From a actual helping of low back pain advantage, the one instance that I've found it to be helpful is when someone has discogenic or disc herniation type low back pain. And for those of you who have listened to other Coffee Talk, we talked a bit about the anatomy of the spine. But the spine is like blocks the lower back, actually the entire spine more or less blocks within between the discs, which are the cushions that allow the spine to move, and they're more mobile and soft. And you can have a disc injury, and the disc actually has sensory nerves that go to it and give you low back pain from the injury to the disc itself. And when you're sitting, you actually put more weight on the discs than when you're standing or lying down. If you're sitting in the car and you're bouncing up and down kind of a thing, and you're banging those painful discs. Sometimes a low back support will offload the spine some. So as you use that back support, it can maybe stretch you a little bit, give you a little more support to those discs, so the bouncing or the sitting doesn't quite compress the discs as much or inflame them as much as you're sort of bouncing up and down. So that may help. Now, you may not have discogenic low back pain. You may have low back pain from a joint problem, or maybe your hips or your sacroiliac joint, or these other things, and it may not help that. So usually what I tell patients, if they say, hey, will it help? Let them try one on, and let them, it should help right away. They sit there and say, yeah, I feel a little less pain when I'm sitting or drawing on in the chair. Then they can certainly try it. The cost should not be excessive for the lumbar support. Should be thousands of dollars. They should be relatively inexpensive. And that may help. People also ask, does it decondition your back? And then it really doesn't. It doesn't decondition your back. The only thing it may do is if you wear it all the time and don't move because you're wearing it, you're afraid to do something, that in itself, could be somewhat deconditioning, that you're just not moving the way you should. So it's a balance between the sensory feedback and just not trying to move at all. But generally, it doesn't weaken your low back. It may help some people with the discogenic component of low back pain because it offloads the spine a bit when you're sitting, and it may give you that sensory feedback too, to just make sure you lift and bend correctly. So that's really the take for low back supports. and whether they help or hurt. I did reference a little bit the rigid supports, and as it turns out, the rigid supports, which we've not really used them that much anymore. Used in the past for people who've had low back fusions. The concept is like a broken wrist or wrist surgery. You put the cast on or the splint on, the rigid brace, and it stops the fracture from moving around and allows it to heal. So similarly in your low back, you wear a brace. The idea is it stops those things from moving so that the fusion you put in there will take. Turns out that the spine is a fairly complex thing. It's not that easy to figure out at times. And that kind of rigid low back support, that clamshell thing, actually makes your spine move more in many instances. So it's actually counterproductive. If you want to stop someone's spine from bending and moving in their low back, you have to put on something called a hip cuff. You basically have to immobilize their hip so they can't move their hip because the spine is a complex structure and a lot of things move when the spine moves. The hips, the sacroiliac joints, the joints of the back, the facets, the discs, the muscles, they're all moving. So if you want to stop it from moving, you got to sort of stabilize the whole area from back to hip. So those kinds of rigid braces, not super effective. There are some hybrid kind of braces where there's soft, like a little stays in back. I have not found them to be particularly helpful versus just a soft support. But if someone tries it and they think that's the way to go, that's probably fine. It's not really immobilizing your spine for the same reasons I just mentioned. So low back supports, they can help some. One does not want to be married to the low back support, but people can use it as needed as a reminder, and maybe for the discogenic low back pain or driving in a car and bouncing up and down, it may actually help. And I think that's my take on it. So I'll see if there's any questions from the audience on low back supports. I'm asked all the time, low back supports. Can I wear them? Do I wear them? Should I wear them? So hopefully I've answered some of those questions. We have no questions. We've cleared this topic up. Oh, no, there's a question. How many hours a day should you wear this support? As I alluded to earlier, one should try not to be completely married to any one thing. Generally, the low back supports, when they help when sitting or driving in a car and bouncing, that would be the time to wear them. I wouldn't wear them all the time if that's the time they really are the most useful. From that sensory feedback, I'm out in the yard or I'm going to do some work and use it for that, and then take it off. I think if you feel that if you take it off, your back is hurting, and then there's probably more going on than simply a low back situation. So I don't think there's a hard and fast rule, so many hours a day, but I would use it as needed in those instances when it does help. And if you really need to wear 24/7, then you might want to look at some other causes of low back pain, other ways to treat it, because it shouldn't be needed for that length of time. See, are there any other exciting questions? That was a good question. People ask me that too, and I want to wear it. If we have any more, take just another sip of coffee. I'm a little worn out today for maybe the end of the week. That's probably what. From the standpoint of where to get your low back support, you can get it at any of the local stores, Walmart, or they may have them. I don't know if they have some of the pharmacy stores, CVS, so on, may have. I can order from Amazon, this kind of thing. The one thing I will say is sometimes ones that have, you wear it a lot. There's ones that sort of cross over and it's Velcro, and then over time, the Velcro just pulls apart. There's ones that do that, and they have additional sort of straps that go like this, cross over, a little more stable, maybe a little more long-lasting if you're looking to try that. The ones that are just the Velcro, those are more like abdominal binders, which one would use for some abdominal surgery or to hold dressing in place. So we might want to avoid those. There is another traction question. I think no, that's a different question. Okay, how can low back support help with posture? Okay, well, and when sitting, well, talked about sitting already a little bit. The posture, the answer is if it reminds you to sit up straight, then yes, it can help posture. It's not in itself going to help posture. Posture, there's a lot of things that go into posture. In sort of a general sense, with the spine, there's fixed things and there's non-fixed things. So there's things that are more mobile. So you have a fixed deformity, so to speak. Your spine is a little more curved than the other. Back support is going to help that. It's going to be where it is. But most people are just sort of hunched over because they're just, they're that's the way they walk or that's the way they sit. And maybe I'll sit up straight now. And will a low back support help with that? To the extent it reminds you to sit up straight, the answer, yeah, sure, would help you to do that. And maybe after a period of time, you can take it off because now you have the habit of sitting up straight. But in of itself, it won't help posture. When the discussion on braces and scoliosis and that's a completely different topic. Soft supports won't help that kind of thing. There's different kinds of scoliosis, so maybe there's a talk on braces and scoliosis, rigid braces and scoliosis down the road. But for low back pain, it's not going to help posture unless it reminds you to sit up straight. I think those might be our questions here. I'll give it another moment. That's a good question. Yeah, it reminds me to sit up straight. There we go. Yeah, but as I said, don't spend a great deal of money on these lumbar supports. It's likely not worth it, at all. Well, I think we may have covered the topic, so maybe a little less, a minute or two to spare. And I thank everyone for tuning in today for our coffee talk on low back supports. And again, if you have any topics you'd like to hear, maybe the scoliosis one or one on cervical supports or something, which is a different topic itself. We can discuss that maybe next time in the near future. And these talks are also on our website. So if you missed one, you can check it out there and give us a comment and feedback on there too. Thanks so much. Have a great afternoon, and hopefully all preparing for the holidays well. Dr. Nucci from Nucci Medical. Take it easy.